हम होंगे कामयाब, हम होंगे कामयाब एक दिन।
हो मन में है विश्वास, पूरा है विश्वास,
हम होंगे कामयाब एक दिन। हम चलेंगे साथ साथ, डाले हाथों में हाथ, हम चलेंगे साथ साथ एक दिन।
First effective recommendation in COVID is adopting better social practices. Using face masks at all times, mindful sanitization wherever indicated, and maintaining social distancing of at least 3 feet have to become a way of life.
Good evening everyone, this is Dr. Anish Krishna, Founder, Chairman, Trustee of Chest Council of India. The symptoms of mild COVID are as follows. The respiratory symptoms are like cough, breathlessness, malaise, nasal blockage, even running nose, and also in the respiratory tract, we should tell GI tract, loss of smell and loss of taste are also prominent. These are the symptoms. Other than this, the patient has got a generalized body ache, what I told, malaise, fever, plus at times it can result in loose motions also. If you have any of such symptoms, please approach your doctor immediately and get your COVID RT-PCR done, because as long as you are not detected of COVID positive, you will keep spreading the others around you. Take care everyone. Thank you. Bye-bye.
My life is changed. December 2019. My life can easily be divided into two parts, the pre-COVID life and COVID or the post-COVID life. But the way COVID impacted my life, trust me, RT-PCR also has impacted it. Look at the ease with which you can diagnose specific disease. Reverse transcription polymerase chain reaction, a simple technique of combining reverse transcription of RNA into DNA and the amplification of that DNA to give you clue, to give you diagnosis in no time. Imagine less than 2 hours, you get the answer with RT-PCR, and with even better advancement with rapid antigen test. No time, you just take a swab and in front of you, you have results. That has changed my life. When I think about its role in mild COVID, I believe in today's time, diagnosing COVID is equally important as it is to isolate the case of COVID so that it does not spread in community. So when it comes to diagnosis, I may not be so interested in diagnosing COVID as I'm interested in preventing its spread from that principal case to many family members. And hence, even if you have mildest symptom, even if you slightest suspicion of it being acute febrile illness or flu-like illness, do investigate, do ask for rapid antigen test. If your rapid antigen test is positive, take it as COVID positive. But if it is negative, do insist on RT-PCR, and based on RT-PCR results, you take a final call. Thank you.
Markers in mild COVID. Mild COVID or asymptomatic COVID patients, it is very difficult. Which patients will progress into severe COVID and which patients will resolve or fight against COVID and win over the COVID. So it is very essential to monitor them either in home or as well as in the hospital. So basically, coming to the investigations, it is always good to have basic investigations like CBC, that is complete blood count, and CRP, C-reactive protein, in these patients.
Hello friends, is chest imaging like CT and X-ray indicated for all patients with COVID-19 infection? The answer is no. Neither CT nor X-ray is indicated for ruling in or ruling out COVID infection, especially for patients who do not have symptoms or who have mild respiratory symptoms, because in such patients your CT scan cannot exclude or cannot confirm the presence of COVID-19, and most of the CT scan remain normal in the first week of illness. However, your CT scan may have a role when a patient is suspected of COVID and has got moderate to severe respiratory symptoms. Thank you.
Friends, When we talk about hydroxychloroquine and azithromycin, now the results of all major clinical trials are with us, and the recommendation says that these agents should not be used either as a single agent or in combination in any stage of COVID. So recommendations are strictly against the use of hydroxychloroquine and azithromycin. When we talk about the steroid, the guidelines clearly says that steroids should not be used in mild stage of COVID. It should only be used in moderate to severe COVID when the patient is hypoxic and requires supplemental oxygen. So steroids should not be used in mild stage of COVID and even in early stage of COVID.
So in the COVID era, if you encounter mild COVID infections, drugs like remdesivir and tocilizumab should not be used in this population of patients. Hence, these drugs are for use only in patients who have severe disease where there's oxygen requirement and the patients end up in intensive care. In mild disease, the requirement for oxygen is also very unlikely. Oxygen would be required only when saturations drop below 94% or ideally below 90% before starting oxygen. Oxygen therapy should normally be in hospital because if you require oxygen, it means you have severe disease, and severe disease needs hospitalization and treatment. In trying to decide whether oxygen requirement might happen or not, it's a good idea to get the patient to walk. If you have access to your patient, walk the patient yourself. If you do not have access to your patient, ask them to walk and check their saturations. The walk should ideally be for 6 minutes, or if you cannot manage that, it could be for a duration of 2 to 3 minutes.
The question of whether to anticoagulate or not in mild COVID-19 is a controversial one, but we have chosen to go with our recognition of the pathogenesis of problems even in mild COVID-19, which often leads to clots forming later, including myocardial infarction, cerebral vascular accidents, and peripheral thrombosis, along with pulmonary embolic disease. So all our patients with mild COVID-19 get a single antiplatelet agent, usually aspirin, along with a statin. So I think this is the way to go until more robust evidence accumulates. Thank you.
Cocktail antibody is a game changer, especially for those who have mild SARS-CoV infection with comorbidities. It is the only treatment I feel is available now for viral phase of the disease.
Patients diagnosed with mild COVID-19 are usually advised home isolation. They should be provided a single room which is well ventilated and preferably with an attached toilet. They should restrict their movements in the house and avoid contacts with elderly, pregnant women, children and people with comorbidities. They should not use or share items with their household contacts like utensils. They should be very careful of all the warning signs, and in case they develop cough, fever or desaturation, immediately report to a healthcare center nearby. Frequent hand washing with soap and water for a minimum of 40 seconds should be done frequently, or alcohol-based rubs can be used. They should wear masks, particularly triple layered masks, all the time, and these masks should be dealt with very carefully while they are being discarded. Thank you.
Hi friends. A COVID which is moving from mild to moderate is typically marked by oxygen going down, increasing breathlessness, sometimes low heart rate or bradycardia, and sometimes a fever which is going beyond the reasonable date, an unresponsive fever. But the most important is worsening oxygenation, particularly on exertion or walking, and if the pulse oximeter going below 88 is the sign where it is moving from mild to moderate, and the person should move into the hospital.
Good evening everyone. As we know, India is going through multiple COVID waves now. If you have not taken the COVID vaccination till now, kindly get one as soon as possible. If you have suffered COVID, after 3 months of turning negative, kindly take a booster COVID vaccination shot. Thank you.
Hello everyone. In view of the third COVID wave, I would like to tell everyone that the children in COVID may present with fever, cold, cough, diarrhea or even skin rash. But the good thing is that more than 90% of them are going to be either asymptomatic or maybe with very mild symptoms. And there is no specific treatment which is required in children. Only the symptomatic treatment for the upper respiratory symptoms or the diarrheal symptoms is good enough to solve the issues. So we are well prepared and we don't need to worry about the third wave.
Hello everyone, I am Dr. Atri Gangopadhyay, pulmonologist, East Zone Governor, Chest Council of India from Ranchi. I would sincerely pray that the third wave does not come. But in case, we must be prepared. So I want to give this simple message. We human beings are social animal and we crave society. We all love to party. But if there is a lockdown means there is threat to your life by socializing. So in case of lockdown, we should all act responsibly and say no to physical party, use digital medium for party, or wait for that lockdown to get over to party. We should all be alive and healthy so that we can party. Avoid partying in any lockdown. Thank you. Have a nice day.
Good evening, friends. This is Dr. Vijay Kumar Chinnamchetty, Senior Pulmonologist from Apollo Health City, Hyderabad. I'm here representing CCI as CCI Webinar Coordinator. COVID-19 guidelines are rapidly changing. In fact, very confusing to even practicing pulmonologists. That's why my urge to public is not to look into social media and take whatever the news that is available in the social media and then follow those precautions or advices. My strong urge is strictly follow the COVID appropriate behavior and stay away from social media posts and reach experts when you really require medical care or pulmonology care or COVID care. Look up to CCI pulmonologists for expert care and global standard care. Thank you.